Welcome back to Mind Matters, the podcast where we unpack the fascinating world of human psychology. I'm your host, Lily, and with me today, as always, is the brilliant and ever-informative Robin. Hey, Robin.
Hey, Lily. It's great to be back and diving into another intriguing topic with you.
Absolutely. Today, we're really digging into some areas that touch a lot of lives: anxiety and obsessions. We're going to break down Generalized Anxiety Disorder, or GAD, and then shift gears to Obsessive-Compulsive Disorder, or OCD. Robin, let's kick things off with GAD. What exactly is it, and how does it show up for people?
Great question, Lily. Generalized anxiety disorder, at its core, is about excessive, chronic, and often unreasonable worry. It's not like worrying about a specific exam or a big presentation. It's more like a constant hum of anxiety about multiple life events or activities. Think of it as free-floating anxiety, because it's not tied to one particular thing, unlike phobias, where the fear is really anchored to a specific object or situation. People with GAD often describe their worrying as really hard to control. Free-floating anxiety. That's a powerful way to put it. So it's not just a bad day of worrying. It's something more persistent. What are some of those key signs that someone might be experiencing GAD? Exactly. It's a persistent pattern. The DSM-5, which is essentially the go-to guide for mental health professionals, outlines some pretty specific criteria. For someone to be diagnosed with GAD, they need to experience excessive anxiety and worry on more days than not for at least 6 months, about a variety of things like work or school performance. And, as I mentioned, they find it really difficult to control this worry. Beyond that, it's usually accompanied by at least 3 or 6 other symptoms, and for kids, it's just one. Oh, tell me about those other symptoms. What else are we looking for? So these can include feeling restless or on edge, being easily fatigued, having difficulty concentrating, that mind going blank feeling, irritability, muscle tension, and sleep disturbances, like trouble falling or staying asleep. Imagine someone who's always feeling tense in their neck and shoulders, constantly tired and finding it hard to focus on a conversation because their mind is racing with worries about everything from their family's health to their finances, even minor things. It's a continuous state of unease.
Wow, that really paints a picture. It sounds incredibly draining. Are there specific reasons why GAD might develop? What are the causal factors?
There are several perspectives, Lily, covering biological, psychoanalytic, behavioral, and cognitive behavioral factors. From a biological standpoint, there is a modest genetic component. Twin studies, for example, have shown that if one identical twin has GAD, the other is more likely to have it than in fraternal twins. There's also evidence for a shared genetic predisposition between GAD and major depressive disorder. So it's not entirely just about life experiences. There can be a biological blueprint there. Precisely. And on the neurochemical side, we look at things like GABA, which is an inhibitory neurotransmitter. It's supposed to help calm down the anxiety response in the brain. A defect in this system might mean anxiety isn't brought under control effectively. Also, the corticotropin-releasing hormone, or CRH, which is activated by stress, plays a role as an anxiety-producing hormone.
Fascinating. So it's a complex interplay of our genes, our brain chemistry, and then I imagine how we interact with the world around us. What about treatment for GAD?
Absolutely. Treatment for GAD typically involves a combination of psychological therapy and medication. Cognitive behavioral therapy, or CBT, is a big one. It combines behavioral techniques like progressive muscle relaxation to ease physical symptoms, with cognitive techniques like cognitive restructuring to tackle those anxious thoughts and cognitive distortions. Even though GAD can be tough to treat, CBT has been quite successful, sometimes even as effective as benzodiazepines, and can help people gradually stop their medication.
That's really encouraging to hear.
And what about medication options?
When it comes to medication, general practitioners often prescribe benzodiazepines for physical symptoms like muscle aches or breathlessness. These can offer quick symptom relief, especially for physical symptoms, but they do carry a risk of dependence. A newer drug, buspirone, is effective for psychological symptoms and doesn't lead to dependence or sleepiness, though it takes a few weeks to show its effects. Certain antidepressants also help, but they also require several weeks to become effective. So a multi-pronged approach seems key for GAD. Now let's pivot to obsessive-compulsive disorder, or OCD. It's often misunderstood. Robin, how would you define OCD for our listeners? OCD is characterized by unwanted, intrusive, obsessive thoughts and distressing images, which are usually followed by compulsive behaviors. These compulsions are basically actions performed to try to undo or neutralize the obsessions, or to prevent some dreaded event from happening. Think of it this way. Everyone might occasionally check if they locked the door. But with OCD, it's much more excessive and distressing. It significantly interferes with daily life. So the key is the intensity and the disruptive nature of it. Can you give us some examples of these obsessions and compulsions? Of course. Obsessive thoughts often revolve around themes like fears of contamination, thoughts of harming oneself or others, pathological doubt, a strong need for symmetry, or even religious, aggressive, or sexual obsessions. For instance, someone might have terrifying thoughts about accidentally poisoning a family member, even though they know it's illogical. To deal with these tormenting thoughts, people are compelled to perform what we call compulsions.
And what do those compulsions look like in real life?
The 5 primary compulsive behaviors are cleaning, like excessive hand washing, checking, ordering, arranging, and counting. Imagine someone who washes their hands for hours until their skin is raw and bleeding, or someone who checks if the stove is off so many times that they can't leave their house for an appointment. These acts provide temporary relief from the anxiety, but it's short-lived, so the person feels driven to repeat them over and over. That sounds incredibly debilitating. What causes OCD? Is it similar to GAD in terms of biological and other factors? There are some similarities, Lily. For OCD, there's a modest genetic component. Studies show that first-degree relatives of someone with OCD are 3 to 12 times more likely to have it than in the general population. There's also a significant genetic link with tic-related OCD, especially in childhood cases tied to Tourette syndrome. So it's not just in their head. There are actual differences in brain function. And how do we typically approach treating OCD? You're absolutely right. It's a very real neurological component. For treatment, a type of CBT called exposure and response prevention, or ERP, is highly effective. This involves gradually exposing the person to the situations or thoughts that trigger their obsessions, while preventing them from performing their usual rituals. For example, someone with a fear of contamination might be asked to touch a dirty object and then resist the urge to wash their hands immediately. Over time, they learn that their anxiety decreases without performing the ritual and that the feared outcome doesn't actually happen. That sounds incredibly challenging, but also incredibly powerful. What about medication for OCD? Medication also plays a significant role. Selective serotonin reuptake inhibitors, or SSRIs, are commonly used because they affect the serotonin system in the brain. While it might seem counterintuitive since increased serotonin activity can be linked to OCD symptoms, long-term use of these antidepressants helps normalize serotonin levels, reducing symptoms. Clomipene, an older antidepressant, has also been found to be quite effective. This has been incredibly insightful, Robin. If there's one key takeaway for our listeners about both GAD and OCD, what would it be? I think the biggest takeaway is that both generalized anxiety disorder and obsessive-compulsive disorder are real,
impactful conditions with identifiable symptoms, causal factors, and effective treatments. They're not weaknesses or character flaws, and help is available. Understanding these conditions is the first step towards seeking support, reducing stigma, and improving quality of life.
Perfectly said, Robin. It's about understanding, empathy, and help. Thank you so much for breaking down these complex topics for us today.
My pleasure, Lily. Always happy to share.
And thank you, our wonderful listeners, for tuning in to Mind Matters. We'll be back next time with more insights into the incredible world of the mind. Until then, take care.